Hi, this is Phil Dougherty, President of OnlyHealthInsurance, and I appreciate the opportunity to help you with your Medicare-related insurance decision. The task to understand and navigate the world of Medicare can be daunting, with a massive onslaught of information and recommendations from our government, carriers, friends, families, and healthcare providers. More questions and confusion can result. We appreciate the opportunity to help you with your decision and to make some of this less burdensome. The Medicare Part D prescription drug program, just one part of Medicare, has brought some financial relief to many Americans and is a crucial piece of one's healthcare insurance coverage. With it, however, are new rules, new terms, and more choices that require more decisions. And this requires more of your valuable time. However, our experience of working with the Medicare Part D program since its inception in 2006 has shown us the importance for clients to take some time to understand the program and learn some of its basic rules and policies. The federal government created this program, its rules and guidelines, and they asked private insurance companies to then design and offer plans that abide by the program directives. So even though Part D is a government program, you are actually buying a Medicare Part D plan from a private carrier. Blue Shield, Blue Cross, AARP, and Humana are just a few of the familiar carriers that offer qualified plans. Before explaining how it works, let me first share with you some important facts about Part D. Medicare Part D is voluntary. You're not required to enroll in a plan. If you do enroll, there are no restrictions on pre-existing conditions, meaning you can't be refused coverage based on your health, no matter how many medications you take or how expensive they are. And you can change plans every year to meet your changing prescription drug needs. The Medicare Part D plans offered must match the same framework or benchmark that Medicare created. Here's our rendition of the framework. All plans have 4 levels or stages: the deductible level, initial coverage, the coverage gap or donut hole, and the catastrophic level. And beginning every January 1st, plans must all start with the deductible and then move clockwise through the course of the calendar year. The deductible can't be higher than what Medicare allows. Plans are free to offer a lower deductible, and many plans do, and some have no deductible at all. After the deductible is met, if there is one, the plan begins to provide benefits in the form of copays or percentages. This is the initial coverage stage. Depending on the type of medication, generic, brand, or specialty, different copays or percentages will apply. Once you and the plan have paid a combined maximum amount set by Medicare, you leave the initial coverage level and enter the coverage gap or donut hole. Initially, when the program started, this is when the member paid 100% of their drug costs. Though very few plans provide benefits in the donut hole, there are substantial discounts provided for brand name and generic medication by the plan and drug manufacturers. Typically, though, one's share of cost increases in this level. So the donut hole starts when the member and the plan have met the initial coverage level limit and does not end until the member alone has spent the maximum donut hole limit or ceiling. In this next stage, the catastrophic level, your medication costs are reduced to very low copays or percentages and will continue until the end of the calendar year. Depending on the number and type of medications people are taking, they can enter these levels at different times during the year. Now, there are a number of factors to consider when evaluating the many plans available. The amount they charge for the plan, the size of the deductible, does the plan cover your medications, the size of the list of covered medications or drug formulary, the plan rating or service and performance, restrictions placed on medications, and plan reputation and experience, and then finally, preferred pharmacy discounts provided. There are websites with online tools available to help you sort and rank plans based on these and other factors. Now, I'd like to share with you some warnings. There's no guarantee that the plan you choose will cover the medication you may be prescribed during the plan year. And with few exceptions, can you change plans during a year for that same year. There is an appeal process to request coverage, but there's still no guarantee. Also, if you choose not to enroll in a Part D plan, but decide to enroll later, you may be penalized for not enrolling when you could have. Though a penalty isn't much to start with, it increases the longer one is without coverage and remains for as long as you have a drug plan. In addition to the penalty, deciding to enroll later means waiting for the annual open enrollment period, which is October 15th through December 7th. You have to wait for this period to enroll for a January 1 start date. This could mean being without prescription coverage for many months when you may suddenly need it. Our recommendation to those who are considering not enrolling, perhaps due to little or no current need, is to enroll in a lower cost plan. It keeps the penalty away and could provide some valuable coverage for any unforeseen prescriptions. This would be for those who have no other source of prescription coverage. For those who are enrolled in coverage, the same annual open enrollment period as above can be used to change plans for the next calendar year. We recommend carefully reading your current plan's renewal packet. And if you're happy with the plan, the cost, and the customer service, you can stay put. The plan will automatically enroll you for another year. The plan premiums range between about $10 a month and over $100 a month. Higher income seniors may be charged an amount in addition to this plan premium. The adjustment, as they call it, will be communicated to the beneficiary by Social Security. With our extensive knowledge of Medicare Part D, our familiarity of online evaluation tools, and our experience in the Medicare-related insurance market, we are able to analyze available plans to cover your specific medication requirements to meet your overall insurance goals. We provide a one-time personal Part D evaluation for our new Medicare supplement clients, and if you would like our assistance with identifying an appropriate Part D plan, please complete one of our drug forms, which you can obtain by request or on our website, OnlyHealthInsurance.com. Your evaluation will include a review of all Medicare Part D plans to identify plan options that can best serve your current utilization. We will also provide you with a report and primary plan suggestion, explain how the program works, and answer any questions. What you will learn in this process will help you in future years when evaluating plans on your own. If you would like our assistance in future annual open enrollment periods, we'll provide the same consultation for a fee. I hope you found this time spent worthwhile. We appreciate the opportunity to be of service to you. Thank you.